As a doctor who's done thousands of breast exams, there's one method I recommend to every single patient. And if you're not checking your breasts the right way, you could miss something serious. Most online tutorials leave out one critical step, and that's where problems begin. How do I know? I'm a breast surgeon. It's literally my job to do it properly. And I've examined thousands of breasts, and I've seen what can happen when a lump is missed. So in this video, I'll show you the exact method I use, and I teach every person I see. You'll learn what to do, why it matters, how to adjust for larger breasts, and the right way to check your armpits. And at the end, I'll tell you the changes you need to make if you're pregnant or breastfeeding, you've got implants, or you've had breast cancer. Over half of us don't check our breasts, and I didn't check mine. I was a 40-year-old breast surgeon, and I thought I was invincible. And then one day, after a shower, I noticed a lump in the mirror, and 4 weeks later, I was starting chemotherapy for a stage 3 breast cancer. And I still wonder if things would have turned out differently if I checked every month. So when should you check and how often? Social media often says to check on the first of the month, and that's fine if it helps you remember. But if you still get periods, it's better to check mid-cycle when your breasts are less lumpy. You need to know what's normal for you so you can spot any changes. Set a reminder in your phone, and there are apps like Copperfeel which will send you a monthly reminder so you never forget. There are 3 parts to a breast exam: looking in the mirror, feeling your breasts or chest, and feeling your armpits. Let's start with looking. You'll need to strip to the waist and stand or sit in front of a mirror, whatever gives you a clear view. First, check the shape and size of your breasts. They're sisters, not twins. It's normal for one to be slightly bigger or for one nipple to sit lower than the other. What matters is knowing what's normal for you so you can spot a difference. I want you to look for a visible lump, a dimple, or a change in size or shape. Has the skin changed colour? Is there a rash or a nodule or a spot on the skin? If your breasts are large, lift them to check the skin underneath. Then look at your nipples. Is one suddenly pulled in? Is there a watery or bloody discharge? Now turn left, and then turn right, and look again. Now you're going to lift your hands up, and then put your hands on your hips and press in. Now you might be wondering why we do this. It's not a workout, it's how we spot subtle early signs of breast cancer. Here's why. Inside your breasts are strands of stretchy connective tissue. They hold the breast in place and attach it to the skin. When cancer grows, it tethers those strands. So when you raise your arms, you might notice a small dimple where the skin can't stretch. And when you press your hands into your hips, you tense your chest muscles. And if there's a tumor near the muscle wall, it can cause another dimple. And that's why this part of the exam matters. So now you know what you're looking for and why, you're far more likely to remember it. Now it's time to feel your breasts or chest area, and this is where many people go wrong, but it's not your fault. Most tutorials tell you to do this standing up, and that's fine if your breasts are small like mine, but if they're large, you should be lying down, and this is why. The aim is to press your breast tissue against something firm so you can feel any area that's thicker or different from your normal texture. Your rib cage gives you that firm surface. If your breasts are small, like mine, that's fine. But if they're large, the lower half drops down before going up to your ribs, and that creates 2 layers, and it's easy to miss things in the bottom layer. That's why breast surgeons examine you lying down with your hand behind your head. It lifts the breast onto the chest wall so we can feel all the tissue. If your breasts are very large, you can roll slightly towards the opposite side to bring more tissue onto the rib cage. At home, lie back on a couple of pillows in bed or in a bath if you have one. Use the flat pads of 2 or 3 fingers and move in small circles with a firm pressure. Keep your fingers flat, don't poke with the tips. And your breasts are shaped like teardrops pointing towards your armpit, but they can go all the way up to your collarbone and your breastbone. You need to check all of that area. Some people start at the top and work inwards in circles. Others feel from the top to the nipple and then move around the breast like a clock face. Pick one. You may do one on one side and something different on the other. It doesn't matter as long as you feel all of the tissue. So how do you know when you found a lump? Most breasts feel lumpy, a bit like sweet corn and jelly. What you're feeling for is something that feels separate to the rest of your breast, like this lollipop underneath my sponge. The final thing you need to do is to check your armpits, and this is another step that many videos get wrong, and if you follow their advice, you could miss the only sign you have breast cancer. And it's because they all tell you to feel above your armpit with your hand in the air, and that's the one thing you should never do. Your armpits contain fat, blood vessels, nerves, and lymph nodes. Lymph nodes drain and filter fluid from the breasts and your arms. If you have breast cancer, even a very small one, cells can travel to these nodes and start growing before a breast lump can be felt. Your lymph nodes sit high in the armpit above the hairline, and they're usually pea-sized or smaller. If you're feeling here, you're just feeling the muscles of your arm. It can also be hard to reach high up in this position. The key is to relax your arm. Rest your hand on your opposite shoulder and let that arm go floppy. Now feel high up where your armpit hair grows. Push in towards the ribs, and you're feeling for something that's like a chickpea. If you've got breast implants, you do exactly the same, but you push the breast tissue against the implant, not the chest wall. If you're pregnant or breastfeeding, it's harder as your breasts are changing all the time, and sometimes worrying changes are dismissed as part of pregnancy. This is where you need to stand your ground, and if one side feels different to the other, or you notice a skin rash that's not going away, or an infection that doesn't settle with antibiotics, please push to be seen in a breast clinic. If you've had a lumpectomy or wide local excision, you still need to check your breasts, and your breast will feel different to the other side due to scarring and radiotherapy changes, but doing it every month will help you learn what your new normal is on that side. If you've had a mastectomy like me and you only have one breast, it's also hard because you have nothing to compare it to, but you still need to check the skin and your armpits on both sides. What do you do if you find something? Well, first, take a deep breath, because it might not be serious. Most of the women I see in my clinic don't have breast cancer, but it's always better to be safe. Make a note of what you found in your phone or diary and set a reminder to check again in 2 weeks. If it's still there, get it checked. I want you to make an appointment if you notice any of these: a new lump that's been there for more than 2 or 3 weeks, a dimple in the skin, a change in breast size or shape, a skin or nipple rash, a nipple that's become pulled in, bloody nipple discharge, or a new lump in the armpit. And if you want to find out what happens at a breast clinic, you can watch this video. I'm Dr. Liz O'Riordan. Thanks for watching. Share this video with everyone who needs to see it.